First of all, to give you some background on who is Siemens Stiftung, what are we doing within the WASH sector? We support and foster social entrepreneurship organizations, approaches and initiatives which provide safe water to rural communities, mainly in East Africa, but we also venture into some West African countries. Within this approach, we focus in particular on access to water, as well as the lenses water and hygiene plus health, water hygiene plus climate resilience, as well as water and hygiene plus gender aspects. So what does it mean to us to foster and support WASH enterprises? I must say that we as a foundation, we come very much from the operational side with experience and learnings from the field. So Safe Water Enterprises and the hygiene social marketing campaigns we did together also with the local partner Kwaho is an example for that. We also got engaged in setting up a social enterprise called Wetu in Kenya, which operates on a bigger scale. And also partner like with Wave Solutions, a rural water service provider in 7 districts, co-funded by the German government, and also partner with other funding organizations to support social impact enterprises, for example, WaterQuip in Uganda. So this is just to give you some examples what we do and with whom we collaborate and work. Concretely, fostering, supporting WASH enterprises means we provide financial support like grants, loans, as well as non-financial support, could be training, mentoring, coaching, consulting services, on business modeling, technical advice. We also engage in incubation and acceleration programs, and also engage in ecosystem development and advocacy for social entrepreneurial approaches. So today we'll focus on safe water enterprises in Kenya, and I'd like to introduce the approach to you a bit before we hear from EED on the study and the results. So we started Safe Water Enterprise in 2013. Together with our partner from Sky Juice Foundation, and later on with Kwaho, Kenya Water for Health organization, with the intention to build and prove a decentralized kiosk system which can be run by local partners and become technically as well as financially self-sustainable. We never expected the kiosk to be able to scale. However, we see a bigger potential than expected for reliable water service provision through decentralized kiosk systems, especially in the rural areas. How does the model works? Which components did we apply? You can see here on the slide that we work with a very low-key membrane ultrafiltration unit. The technology we use works with just using gravity. It can produce up to 10,000 liters, and it does not require any chemical treatment, as we are convinced that people have a right to have safe water without the chlorine in it. Kiosk is standardized, prefabricated, modular, expandable, and some use also water ATMs. We work with water users associations to operate the kiosk. They are registered as small-scale water service providers. And we also involve the local stakeholders, as this is crucial for the buy-in of the customers. And also the price setting was conducted in partnership with the community. And the social entrepreneurial approach means that the Safe Water Enterprise is designed to become financially self-sustainable, which means the revenues from the water sales cover the running costs and ideally generate a surplus that can either help the kiosk business to grow or contribute to some local village savings and loans associations to build capital. So just a brief introduction on how the project implementation process looked like. After site identification, and we very much put a a lot of attention to that. We start with the operational preparation, the first management trainings, identify a group that would be our partner on the ground. Then the whole community is informed about the plan in a community gathering before the kiosk construction starts. And then we have a complete or very comprehensive training manual with different modules to kick off the kiosk operations. We'll have an opening ceremony, and the most important is the monitoring and the coaching in the long run, so that the kiosk can run sustainably. And after a certain period of time, we also transfer the ownership. So with this background information, I would like to hand over to Elma Odiambo from EED, now giving us a presentation on the key results and the recommendations on how to move ahead with a safe water enterprise, but also with decentralized systems. So Elma, the floor is yours. Thank you.
Thank you, Christine. I'll pick from where you just left. And based on the background that you've already provided, onto the next slide, we see three things. There was the issue that was to be addressed, and then there was the intervention, and then the expected results. I'm not sure whether you want to do the next slide already. I can't see it.
Yes. This one?
No, the next one.
The next one?
Yes.
Okay.
Yes. So as you are aware, from a Kenyan perspective, we have close to about 20 million people still lacking access to safely managed water. And this means that they are exposed to surface water or water that is not safe for drinking. So having this in mind, as Christine has mentioned, in partnership with the Sky Juice Foundation, with the technology she has demonstrated, then they commission these projects across the communities to ensure that safe water is provided to these people. And the expected results were that we have increased access to steady supply of safe drinking water, which is clean to these rural and underserved communities. And on the map on your right-hand side demonstrates some parts of this area. So we have one in Kangemi, we have another in Kiambu, we had another kiosk in Muranga, we have others in Migori, Homa Bay, and Kisumu, and we also had others at the coast. But for the purposes of this study, we only assessed the 6 that are going to be discussed in the next slide. So on to the next slide. How did we do it? So since it is in an impact evaluation, our approach involved 5 major steps. And the way we designed the study is that we wanted to understand from the users who benefit from the kiosk and those who do not benefit from the kiosk, what is really the impact and what are the differences that they are seeing in terms of having access to the safe water. So we had an equal number of users interviewed from what we could call the experimental arm. These are the users that use the kiosk, and then we have the others from the control arm, the ones who totally do not use the kiosk. And with these were selected randomly and used for the purposes of this evaluation. On to the next slide. In terms of the findings, so based on the access that they now have with regards to the kiosk being set up within their communities, we find that depending on the pressure at the water kiosk, you'll find customers spending relatively fewer minutes queuing and filling the jerrycan. So average, you'll find a 20-liter jerrycan will take not more than 5 minutes. And then you'll find also queuing time is also averagely at the same time. So except for Ngoliba kiosk, the one in Muranga, you'll find that majority of the kiosks relatively spend shorter distances. From the two diagrams, you see one on the left side with the Machisafi kiosk users and another on the right side with the non-Machisafi kiosk users. You'll find averagely for the amount of time they spent to fill the 20-liter jerrycan, It's pretty much even across the 20 kiosks. But you see the distance, how that affects water access. So you'll find those who spend much longer distances to access water actually take a long time to get the precious commodity. And then you'll find the communities that live within the vicinity of the kiosk and spend quite a little amount of time, especially those that exist in urban, like the Kangemi kiosk. But you'll find Korumba, Muranga, they spend relatively shorter distances to the kiosk, but you'll find in Sondu and Wathongere, and based on the recommendation that you probably see us recommending in the next slides, will be that some of them are now suggesting that they could have satellite kiosks to help them bridge the gap between the access. So it is evident that there is need to establish other Majisafi kiosks in each of the locations, excluding Kangemi, and this is a priority among the Majisafi kiosk users. So this is why it's a priority. As I mentioned in the last slide, you see distance is a major issue. They now have access to safe and clean water within a shorter distance, and they take less time to fill the 20-liter jerrycan. The queuing time is also drastically or significantly reduced. So you'll find they do not spend much time to get this commodity except for the distance. So this is why the recommendation to establish an additional kiosk, and you see this from the table on your right side, from the other 5 kiosks except Kangemi, there is need to do that. And with regards to our technical assessment and the performance of this particular kiosk, we also find there is need to conduct regular testing and keeping of records of the same, especially for the kiosk that we found their figures in terms of record keeping not consistent enough. And this is useful, especially for the water source and also for the product that they sell to the consumers. We've also seen an issue with the transport chain. So in terms of access, users access water in 2 ways. So one, they can either go to the kiosk directly, or they simply send a water vendor. And you'll find when we have multiple water vendors and they use multiple containers to obtain water to these households, you'll find they may not have one source like Majisafi kiosks. So they have to rely on multiple sources. As a result, along the way, you'll find there is cross-contamination. There are chances of cross-contamination. So that's why there is also the suggestions from the technical side to have the kiosk also established a transport chain that will ensure that the users or their customers always get the right quality of water that could be obtained, whether you get it direct from the kiosk or you send a water vendor. So there was also an issue in 3 kiosks with the time taken to restore, especially the rural water kiosk in the western part of Kenya. So you'll find they do not have that availability of the technician within their locality. So they have to call the technician from far distance. So you find by the time the technician gets to the kiosk, most of the customers are already frustrated. So if there was a breakdown, then it simply means that the consumers will be frustrated and go home and either seek an alternative water source or buy water at an expensive cost. So that is why there's also a suggestion from our technical understanding that time taken to restore this could also be reduced, but this could be reduced by having an in-house technician or one who is reachable within a shorter period of time to help in restoring this. And lastly, I'll be addressing this in the next slide, the issue of non-revenue water. With regards to how they are performing and being able to raise enough revenues to run their operational and maintenance costs, we find that regardless of where they are, whether they're in the urban like Kangemi or peri-urban like Kangemi or rural like Wathongere down in Nyatike in Migori County, you'll find regardless of where they are, cumulatively, each of these kiosks, they post a net positive balance. And this is simply comparing what are they earning, and you have to subtract all the operational costs, including the staffing cost, maintenance, and the rest. And then you'll find they all posted a net positive balance when revenues and expenses are compared together. And this is what you're able to see in this particular kiosk. So if someone wanted to understand whether they are able to meet their operational and maintenance costs based on the revenue they generate from providing the safe and clean water, then yes, there is a net positive balance, and that is a good thing. However, from the technical side, as I mentioned, there are a number of things that could be done to improve their performance in terms of how their financial status or standing is. So on to the next slide. So I mentioned to you something to do with the non-revenue water. So we found out, and we are giving a case study of just 3 of them. We found out that there are a kiosk like the one in Thika, Kiambu County, and also example of the one in Kangemi. You'll find they service institutions. So sometimes the water they produce is also used within those institutions, but is not accounted for. So any water that is lost along the way, not accounted for, either it's been lost through spills or it's been given and not accounted for, it becomes an unrevenue water. So our understanding and analysis of all this scenario and giving the classic example of these 3 water kiosks in Korumba, Maragua, and Sondu, we find that when we don't have differentiation mechanisms, so for example, you'll find other kiosks will want to increase their the cost of a 20-liter jerrycan, for example, or increase their tariffs, in other words or other terms, to be able to raise enough revenue to meet their growing operational demands and the rest of the expenses that they incur. So when we don't have this differentiated mechanism, we find that when they're able to reduce their non-revenue water, from our analysis, if all of them are able to reduce their non-revenue water, and their alternative source of revenue will critically have their revenues grow. So they don't have actually to increase the tariffs or the cost of a 20-liter jerrycan. They only need to work on their non-revenue water to be able to realize a growth in the revenues. And that is what we are trying to depict in this slide, where you find with increased management of how the non-revenue water is catered for or covered within the kiosk, then you find that will translate to more revenues, and then they're able to have surplus income to improve how they provide the water services to the communities. And that will also cover part of the emergency expenses that they're having. So having analyzed the technical side and also the financial side of the kiosk, we wanted to also understand, based on the findings, are these kiosks sustainable? Are they scalable? And what makes them actually sustainable, scalable? So based on the analysis and understanding of what their current situation is, and I'm going to show you this in these 2 figures. So while we find that these kiosks are sustainable, that means they are able to meet their technical requirements, they're able to raise sufficient revenues, and they're also environmentally sustainable. We find that scalability of this kiosk would not be possible in their current state, as they will need an external support to improve. For example, we have a recommendation that they need to set up satellite kiosks, but based on the revenue analysis, while they have a net positive balance, the positive balance will not be able to cater for the construction of another satellite kiosk. And that is why if they are not able to cater for another kiosk, they need an external support, a donor, they need a funder to help them set up another kiosk. But in terms of whether they are able to continue providing their services as they are doing it, with the recommendation to ensure that their non-revenue water is solved, then they will continue to provide quality, safe drinking water to these communities with the 1 kiosk that they are currently having without any stop. They only need to cover some minor adjustment in terms of ensuring that when we have breakdowns, that's sorted in time, when the staff needed to maintain the system, then the staffs are well equipped and everything is in order. But in terms of establishing another kiosk, then that would require some external support, and this could be sourced from donors, and we could also leverage the aspect of a banking institution that will also offer such options for them to be able to set up additional kiosks and improve their service delivery to the communities. And so in terms of what we want to conclude on, based on our findings, we find 4 things. The kiosks have reduced the disparities in access to clean water, especially now you'll find women who would have to travel longer distances to get water do not now travel longer distances to get water. They have to get that water within a short period of time. So we'll find that the majority of Majisafi users experience minimal wait times, as I demonstrated in the previous slides, and with an average of just 5 minutes or less. And then in terms of health-related or lifestyle diseases, so across the 6 sites that we assessed, users also report a reduction in the waterborne diseases, with over 90% of the respondents rating the water as clean and safe. Actually, if you talk to the users of Majisafi, they will mention to you, we know Majisafi by the quality of the water they get. So they're able to recognize Majisafi by just the taste. So if you bring them water and you tell them to tell you, or you ask them to tell you which one is Majisafi between the two, they'll tell you this one we know because we know the taste of Majisafi water. And that has drastically or significantly reduced the chances or the cases of lifestyle diseases like diarrhea, cholera. And this was also evident when we interviewed the health specialists across the site, especially in Migori County, where we have the prevalence of diarrhea. And then in terms of opportunities, because the main aim of the project was also to ensure that we cultivate some entrepreneurial approach within these entities. So we find that the existence of this kiosk has also opened up space for business ventures. So we'll have a number of vendors working with these water points to ensure that they also deliver water, and that earns them money and also earns the kiosk money. And then lastly, this also improves sanitation and hygiene standard that is reported across the 6 sites with, for example, you'll find in Maragua and Sondu water kiosks, they have latrines that serve the community. So the latrine also generates some form of revenues too, to the kiosk. And lastly, as I hand it over to Christine, on the last slide. So while we find there is an immense potential for the kiosk, their sustainability and scalability will depend on their technical and physical management. So we find there's need for some form of training and capacity building. So there's a greater need to build capacity management operators so that they ensure that they're able to update their financial status monthly and be able to record that, so that they could only be able to measure or account for what they're able to see. So they need to have this consistent record to be able to evaluate themselves on a monthly or an annual basis to know how they are growing in terms of trend. And there's also need for enhanced or community awareness or hygiene practices. So Siemens also involve agencies that work within these local communities, including public health promoters or health officers, community health promoters, to work with these communities to ensure that they promote hygiene practices. And we find there is need to continually engage the community on the importance of safe drinking for their healthy living. And then we also need the aspect of partnership for collective action. So for the kiosk to be sustainable, as I mentioned, there is need for local administration, especially the county government, to support the community-based social enterprise models to ensure that they continue to fill the gap, especially in areas where major utilities are not able to reach. Then we find the safe water enterprise kiosk model then can be able to meet those. And then lastly, as I mentioned to you in one of the slides, we have kiosks that have that turnaround time to restore breakdowns taking much longer time. So there is a model that has also worked for the Fundifix previously, and we are suggesting for them that a guaranteed service model like the one that worked for Fundifix, in which the entity that runs operational and maintenance activities like Fundifix is granted a portion of the operating cost to cover the infrastructural maintenance, so that what that will mean is that they're always a call away when there's any issue that needs to be sorted out with regards to maintenance, to ensure there's a steady supply, which is the aim, remember, steady supply of clean and safe water. And when we have breakdown, then that steady supply is cut off. So we need to have that type of a guaranteed service model where this entity covers the operational and maintenance of the system, so that the water supply is steady and they continually enjoy the benefits that also include health benefits with regards to reduced lifestyle diseases. So this is generally the understanding in summary of how the project work and what it's benefited the communities, and there is net positive. So I think in the next presentation, you'll just be able to know what are the stories that they are telling based on the Maji Safi kiosk. And they will be giving you testimonies of how this has impacted their communities. So over to you, Christine.
Thank you so much, Emma. That has been a very, in a nutshell, a very comprehensive presentation of the main results and the main findings from the field research. And thanks for presenting it in such a in such a great manner. If there are any questions from the audience, please provide your questions in the Q&A chat, and we are also happy to receive your feedback in the chat, which we will follow up upon later after this call. Now to give also the people from the sites and from the villages we work with a voice, and just to give an idea of what we are talking about when we talk about Safe Water Enterprise water service provision. We have prepared a video from Korumba Safe Water Enterprise, and Basti, I would ask you to start the video so that everyone gets an impression of what this is all about, and what people say themselves about the kiosk without us talking about them, but also get an insight and get an impression of how they value, what kind of challenges they see in the villages. Thanks, Basti.
Excuse me, just give me 1 second.
Before then, they were collecting their water from very far. So this one has actually helped bring water closer to the people, to bring safe water. My name is Enoch Were, and I'm a member of Korumba Water Users Association. This is a group which started in 2006 as a welfare organization, and later we registered a CBO in 2016. The water business started in 2009 when we collaborated with the then municipal council, who dug us the borehole and put the pump and even put a few tanks and the metering unit, that is the electricity. Now after that, we have been running the system. First, we used chemicals to treat the water, but later on, 2015 February, when Siemens Stiftung came up, they introduced the filtration system, the kiosk system, and since then we stopped using the chemicals.
I've been working with Korumba Water Users Association since the project of the Safe Water Enterprise was initiated in 2015. Having an experience of more than 8 years in the water kiosk operation, I've been able to support other kiosks in maybe doing the water quality check, ensuring that the ultrafiltration units work well. Then apart from that, in terms of record keeping, sales and record keeping, I'm also well versed in, of which other operators are now in a position to be assisted through the experience that I have.
What I love most is when I sell water and make sure that everyone is satisfied with our water there. On my daily basis, I usually wake up at 6. I open the kiosk. Then I do my daily basis like cleaning the machines and the kiosk. After that, I start selling water to the customers who have arrived that early morning.
We made the price a little easy so that we are only selling at affordable price of 5 shillings per 20-litre tin. So this they have found to be very reasonable and very affordable. Currently we are serving approximately 500 homes. Yeah, so we are thinking that with the improvement and the capacity having been improved, we should be able to extend that maybe to 1,000 plus homes. Now, before then, fetching water from a river which is not very safe, there may have been, and I think there was, some of these waterborne diseases. But now, in this area now, those kind of diseases have reduced if they have not actually been wiped out.
Thanks, Basti, for sharing. And then with this impression, I hand over to Stephen to give us some ideas and some insights of what of how the key findings can be used for future interventions and what the future of decentralized water kiosk systems for water supply can be in Kenya. Stephen. Thanks. I'll share the screen.
Thank you so much, Christine. My name is Stephen Juguna. I've been working with the Safe Water Enterprise project for the last 9 years, supporting these communities to manage these facilities in a sustainable manner. After conducting the study, we want to look at what is the future of decentralized water kiosk systems for the water supply in Kenya. And we'll focus on the key learnings that we've picked, like you have seen in the study, and the success factors. So looking at the current situation of water access in Kenya, we could see that Kenya have a goal of achieving universal access to water, and with a budget of about $22 billion US. and it is projected maybe about 11 billion would be available, which is like half of what has been projected. And since this means that there is still a lot that needs to be done to achieve that goal in 2030. And then according to Kenya Demographics Health Survey conducted in Kenya, only 68% of households have access to at least basic drinking water services. And what does this mean? It means that the basic drinking service, people have at least a physical access to water that is within a radius of about 30 minutes to and fro. We also find there's only that 1% of households that have access to water and sanitation services. And in the rural areas, the situation is even dire, where we have only about 44.2% of people rely on private sources. That's like Majisafi Kiosk. We also have private people, entrepreneurs who have own boreholes, and also institutions that provide water at the community level. So it means they have to pay for this service. And because of this gap, we've had different organizations that have tried out decentralized water kiosks to try and fill this gap that has been left by the public utilities. Next slide, Christine. So as the government is struggling with raising the gap of financial need, so we've had many players in the sector, that is entrepreneurs, investors, and donor organizations who have come to the aid of filling this gap that has been left, knowing that safe water decentralized kiosks in Kenya, they provide water to about 3 million people, and this is considered as a low cost solution, because approximately it costs about $15 per person per year, which is cheaper than doing a piped connection, which will cost about between 50 and 60 USD per year. So this one is low maintenance because one facility can serve many people, and like you find in the kiosks that we have, they serve about 500 households, which is translated to almost about 2,500 to 3,000 people in that locality. So there's still a need for these kiosks because they are trying to fill the gap of what has been left by the public sector. Next, Christine. So from the study, we were looking at what did our customers have to say about this project. And for most of them, when they were surveyed, they looked at what were the reasons for selecting this water source. And one of them, which is very critical, is the distance to the water point. And that's why some of the kiosks that are in the rural areas, people are spending a lot of time trying to fetch water in these sources. In some of the areas, it is having almost a radius of 20 kilometers, which is quite long distance, and they will take more time. They also value time spent queuing. In some areas where we have had very high demand, like in one of the facility in Nyatike, that is dispensing an average of about 10 to 15 cubic meters in a day. That means during the dry season, you will have very long queues. But despite this, you find that most of our customers, like 88%, they are satisfied with the amount of water that they get, despite the fact that they have to queue, and they are also satisfied with the price, which ranges between 0.03 to 0.07 per 20-liter jerrycan. And this is a price that has been agreed upon between the management committees and also with the community. You had Elma talk about the quality of water, and people are satisfied with the quality of water. And what does this mean when they define the quality of water? They are focusing on the issue of the color, and this is what they recognize even more. most of the sources of water that we are using have very high turbidity. So you find some of them is brown water. So this filter is able to remove that color. It's also able to remove smell. Because in some of the areas where we are using water pans as the resource of raw water, you find the water is smell. It has some smell, and also the taste. It has distinct taste, but this also will depend from one water source to the other. So how do we improve on the operations of this multi-service kiosk? And this is from what the customers had to say. And you'll find that the majority of them, they feel maybe that they are spending more time at the facility, either queuing or they have to walk long distances. And we also have those who are getting water from water vendors, which they have to pay a higher cost. So the top priority would be establishment of other multi-serve kiosks in each location. And some locations can even absorb even more than one because of high demand. The other one is satisfaction with the time taken, like in Goliba, which is in that area, that's the only main source of water. The other sources of water are highly contaminated because they are served by two big rivers. One of the river is contaminated by water from Nairobi, industrial areas. And so that's why they would prefer that we're able to cut this time taken by establishing new facilities. There are also other priority areas. Other priority is about more taps, and this is about the issue of the pressure. How much time would I spend queuing there? If we have water taps that have high pressure, then it means I can refill my jerrycan a bit fast. And this also affects the water vendors. So you can find one water vendor will sell about 100 jerrycans. So if they have to keep on coming there, it's going to affect the amount of time spent by even individual households. This project has achieved quite a lot of impact that we have observed, and they were also pointed out in the study. And there are a lot of lessons that we can pick from this. They have provided improved quality water access to people who have nevertheless have afforded the quality of water that we provide. And people are a bit conscious about the water that they are consuming. And that's why we've seen there is reduced a reduction in waterborne diseases in those communities. It has also created job opportunities for the vendors. Like in Wathongel, in Migori, you find that kiosk is having about more than 10 water vendors that they have, and they do this as a full-time job, supporting the households that are quite far. They have also saved on time for households in terms of collecting water. And you know, the responsibility of collecting water here in Kenya is mostly played by women and also children. Now they'll have more time to think about schoolwork rather than taking care of fetching of water. And also, most of the households now, they'll have more time for the women to do other economic activities. In some areas, it's also very risky to go and collect water in the river, like in Migori, where we have a very big river. During the rainy season, it usually floods a lot. So that's a risk because when the river breaks its bank, it's a risk for people to go there, and there are also crocodiles. So that has saved them from that risk. So what are some of the key learnings that we've learned that can help in improving decentralized water kiosks? Not only this kiosk, but other even players who are using almost the same model. One of that is efficient and reliable filtration technology. The sky hydrant that we are using is a very robust system that is usually off-grid. It does not require any source of power. It only requires gravity to run, and it can purify up to about 1,000 liters of water. But this will also depend on the quality of the raw water provided. If the water has high turbidity, then it means it will produce less. The other thing is automation of revenue collection. Like you can see in that photo, where this is in Migori, where they are fetching water using a water ATM. That helps a lot in ring-fencing the revenue, and also improves on accountability. The other one is trying to reduce the cost by solarizing the water system, so that you can spend less on water pumping. The ideal situation of this model is that the water kiosk should be at a lower level than the source of water. But now you find in most of the cases, it is the opposite. The other thing that we have learned is about management, that proximity to the access to raw water is very important, because that would help in reducing the cost. And also where you locate the kiosk should be near where we have majority of the households, so that people don't have to walk long distances, and they can access this water even during the evenings or early in the morning. Also having a dedicated operator is very important. One of the requirements when we are setting up these facilities is that we need to have a full-time operator. Because you find in most of communities, they prefer that the management committees, they'll be doing this on voluntary basis. And this affects the operation and maintenance of such systems. The other one is also treating communities as partners rather than beneficiaries, because this will foster more community engagement and ownership of the facility. One of the other things that we realized, setting up a facility does not translate that people will come running for this water because it is safe. You also need to conduct social marketing, just sensitizing the communities of the importance of safe drinking water and how they can maintain that cleanliness of the water. Because like Elma mentioned earlier, there are cases of water contamination because of the jerrycans that they are using. Next. So what are some of the interventions to improve access to?
Stephen? Stephen, are you still there? We cannot hear you, or I cannot hear you.
I
He
think
seems
we
to have
lost
lost
him.
We've lost him.
Yeah, sadly, sometimes the connection is bad. Maybe we pass it on to someone else.
Yeah, definitely. But I think Stephen was just concluding in terms of what we see as the interventions that can be used to improve safe water access. And we had mentioned previously this need for establishing additional kiosks, which will require partnerships with other interested groups, including donors and funders. And along the value chain, that's why you also find the average cost of water would differ. So if the cost of water at a kiosk is 5 shillings, if the vendor delivers that water, averagely the household will not report it is 5 shillings. It will be report it includes the cost of transporting. So establishing a transport value chain that will help to empower the water vendors is also imminent. That will also help in improving water service delivery. And we also highlighted the need to reduce the non-revenue water. That will also help them in growing their revenues. And there's the aspect of initiating and participating in national and regional dialogue to seek support. And this will go a long way in ensuring the scalability of this water kiosk. And lastly, since we also noted that majority of these water kiosks are managed by community members because they were formed from community groups. So you'll find they do not have the much of the technical knowledge. So there's also need for some form of training and professionalization of the water kiosk management to ensure that they know how to do bookkeeping, they know how to efficiently keep their records and be able to forecast their profit margins and also their expenses so that they can manage what they produce and also what they sell. Should we with the next slide?
Exactly, yes.
Yeah, so in terms of how the gap can be filled, so one is to align initiative with development partners. So you'll have NGOs, you have private sector entities that have similar interests. And so when we align the initiatives with what they do, then we'll find there is that aspect of embracing the partnership to come in. You'll have more interested groups wanting to come in to venture into the project. And even as you see from the comments, it's quite an interesting study and interesting intervention that most people will be aligned to. So the alignment of the initiative with the partners will be key, especially to ensure we improve access and also work towards scaling, and also diversifying financing mechanisms, like exploring a mix of financing options, including user fees, tariffs, grants, subsidies. And that's why we also worked around a guarantee service model that will also help in improving the operational maintenance costs. And then thirdly is to explore the innovations, financial models such as social impact bonds, result-based financing, and this in the long term, crowdfunding platforms to ensure that we incentivize achievements of water access targets. And then there's the aspect of private-public partnership that is currently growing as an avenue to ensure government agencies can be able to work with the private sector, as well as the local communities, to leverage the private sector investment and from their technical expertise and also efficiency in service delivery to be able to improve the performance of this kiosk. And then lastly is to promote community ownership and participation. So actually, based on how the project was conceptualized, you'll find the initiation was from the sense of we want the community to own this. And that's why you'll find a number of actors wanting to be part of it. They want to know where Majisafi Kiosk is so that they're able to own it. So there's need to promote that community ownership and participation in the water supply projects, and encouraging financial contribution through community savings and schemes, which we also find is something that is currently ongoing. But if we can be able to improve that, then even the performance of the kiosk will be improved by greater heights. Yeah,
Thanks,
so I
Elmar.
hand it over to Christian.
Yeah, thanks, Elmar, for jumping in. As Stephen, now you're back. I think we lost you at some point. So we just continued.
Yeah, sorry.
And Elmar was so kind to jump in and present the two slides towards the end of your presentation. I'm not sure. I mean, we are now close to the end of the webinar. I've seen that in the Q&A there are some questions, and Sebastian, maybe you could invite and could maybe read some of the questions which are already there, so that we could answer some of them, as Elmar, Stephen, also Paul, our colleague from Kenya, the Kenyan team, who is very very experienced in the technical field, and he's a technical advisor, can answer those questions. Thanks, Basti.
Yeah, absolutely. Thanks at first for we've received a lot of questions during our webinar. That is obviously a good sign, and thanks to Elmar and Stephen and Paul, and also Joyce for jumping in and answering a few in the chat so far. First question I would pose from Marco Weber, directed to you, Elmar. Can you say a bit more about how you try to attract private and public investors to open up new kiosks? Maybe you can come in here.
Yeah, so that will typically be interesting to look at, but we'll have to put a business case, because attracting the private or investors will mean they want to invest where they can gain something in terms of the profitability, but already we can demonstrate that the kiosks are having a net positive balance. So it's more of pitching at a deck in terms of what would them coming in benefit. the community? Will it expand the water service coverage, or will it improve one aspect that is not currently being improved? Can it be in terms of now the guarantee service model that you're saying? They come in to take care of the operational and maintenance cost, and that is what is covered by them, and that is what also is of benefit to them in terms of the technology to help in monitoring the breakdown of pumps and how soon that can be helped. So we wouldn't say there is a straightforward answer into how this can be done, but it has to be put to them in terms of what is the business case of them coming in to improve that in terms of improving the service delivery and also ensuring the kiosks are continually functional. But I have Christine who will also come in on that, since that was also not, the business case was not a part of what we were to present in this.
Yeah, well, the business case is something I think we have elaborated at the beginning when we started the project, and the business case was that the kiosks should become self-sustaining within a period of 1 to 1.5 years. We never expected that the capex costs would be covered by the revenues and by the profits at kiosk level. Where we see the potential of the Safe Water enterprises is that the kiosks are independently run by the community. And at the same time, what they sometimes only need is a kind of a backup, a team that helps whenever they have any questions. And this means that the kiosks themselves they run independently, but they can cover the running costs. But whenever they have some technical like replacements, like the filter, or whenever they would like to grow the business more than like with regard to establishing more storage tanks, we require them to pay a certain percentage, and then we would come in and help them establishing or installing the system. But maybe Stephen, you can also answer this question with the business case of Watsonger, where they installed a water ATM, for example, and they paid back the a monthly fee, and were able to have enough surplus to install a water ATM at their kiosk. So the surplus at kiosk level is there. The capex, I mean, the upfront investments are not there. And this is where we would require and where we would look for management partners, for like having something like an overhead, something like an overhead management to just advise them and to just come in whenever they would need some support.
All right, thank you. We're a bit over time, but I think it's fine if we keep going. Or
Yeah,
what do you
maybe we
think?
can have some 2, 3, 4 questions, and then we conclude.
All right, next question. Excuse my pronunciation if I'm wrong. From Brian Chimimia. were the respondents in the control group in the same location as the experimental group? And if so, why are they then not sourcing from Majisafi kiosks? Either I think Stephen, Elmo, or Paul can come in on this.
Okay, so it's more of a distance. I will say they will be within the vicinity. So how we structured the groupings is that we defined a radius of 1.5 kilometers within the kiosk, and that is from where we could get the experimental group. But then outside are the places where we get the control group. And additionally, for us to have the control group, number one question was that you do not source your water from the Majisafi kiosk, so that we have a distinct category of respondent, because otherwise we'll still be treating the same, we'll still having the same treatment. So we had to define a radius, and then the others that are outside that radius, and that was the one criteria. So you're outside that radius, and also you are not benefiting from the Majisafi. So that also you want to get to know where you get your water and what have been your preferences. Why not Majisafi? So those were that was basically the criteria of defining the separation of the two groups, control and experiment.
All right, thank you. We have a few more. I think in the chat we are almost covered. Next question, maybe again from Marco Weber. That's a quick one. How are you cleaning the filter membranes?
Yes, Stephen can answer.
Maybe I can take that. So the technology you're using is ultrafiltration, and this particular model, which is called a sky hydrant from Skyjuice in Australia, is very mechanical, and also the cleaning is done mechanically through a daily backwash. Okay, the backwash is the main, you could say, thing that the operator does. So, and it depends on the quality of the raw water. So if the water is turbid, meaning that it has more particles, they are trained to do the backwash more often. So, and it's a simple process that takes 2 minutes. So it's a manual backwash, and then once a month we also train them to do a chemical backwash, which we use chlorine, and this is basically just to disinfect the internals of the filter, and this, with the experience, we have some filters that are already working for 10 years, and it works very well, and we have not had many issues. Yeah, thank you.
Thank you, Paul. If we can grab a few more minutes, what is the CapEx cost for setting up a Majisafi kiosk?
I think that would be on my side. The capex cost, when we established the Safe Water Enterprises, was between 37,500 to 40,000. But this does not only include the establishment of the technology, the kiosk, and the storage tanks. It was also including the management trainings, also the community gathering. So when we did that, that was more or less the capex cost for the complete kiosk. Nowadays, with the inflation, I think you would need to count in a bit more.
Yep. All right, thank you. And we have one more left from Brian Chimimi again. What is the approach to capacity building? How do you ensure that there is continuity even with changes in the community management committees? I don't know if Stephen, you can come in on this.
Yeah, so I could take that. So yep. In all the facilities that are being managed by the community itself, we have transformed them into water users associations that have a better transition and succession planning. We also recommend that they are electing new officials, at least a third of the committee should be left behind, so that they can at least support the others who are coming in. And in most of the communities, of course, this is a big challenge in some of the communities that face challenges in succession. But we've had some communities, like the ones that have been part of this study, we've not had a lot of issues with the succession. Like in Korumba, they have had the same management running for many years. And they have always been elected again and again. And in those that need to change, there's a very clear mechanism currently through the Water Users Association that they can be able to transfer this to the next team to manage it.
All right, thank you. These were all questions from the Q&A. I think we covered almost everything from the chat, and pass them back to you, Christine.
Okay, so thank you very much for joining us today. I think we've seen, like with regard to the learnings for the sector, that these decentralized kiosk systems can be a low-cost solution for rural water supply. The water can be sold at an affordable price. The kiosk can become sustainably, financially and technically reliable and sustainable, and it can cover the costs for the OPEX. Still, the kiosks rely on an overhead management, on external funding support whenever they want to scale or grow significantly their business. The supply chain with regard to spare parts or the technology is still not fully worked out. So and the people, the communities, the water users associations, they really need to have a say in also political forums, dialogues, as they play a crucial role for water supply. So impact-wise, we've seen that kiosks can improve health, they improve access to water. We see increased productivity. Also, local entrepreneurship is fostered and supported. So with these, my key takeaways, I would like to thank you all for joining us this morning, afternoon, or evening, from wherever you have joined. And thanks, and wish you a nice day. Bye.